So these are some of the slight stretches that we normally do in the physiotherapy department. Desmond, kidogo. Lala ukiangalia juu. Kunja hii.
I know another question that one will be curious to ask. Hizi exercises nita lose tumbo daktari?
Hizi ndio maana nawaambia hizi ni za low back. Sio za kulose tumbo. Za kulose tumbo pia tuko nazo. Tuta prescribe, but for now hizi ni za low back.
But tunaziona as if they are similar to what they show us, you know, the gurus show us.
Hapana, hizi ni tofauti, ni za kulose tumbo. Cutaneous electrical nervous stimulator. We normally put it at the lower back. This one helps to alleviate pain at the lower back. So when you come for physiotherapy department, we'll use TENS to manage your the pain. TENS machine, you can set it for like a maximum of even 20 minutes.
Two weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air, friends and guests.
Pain, body aches. These are all things that are all normal as long as you're a human being. But then again, it gets to a point where those painkillers are no longer working, and now you need a different kind of intervention. You then hear someone tells you, or you're recommended to get physiotherapy, and now you're lost. You don't know what that is. You don't know where to start. And as always, Grace Park is more than willing to give us the right information. And today we have the physiotherapist at Grace Park, Mary Apudo. And before we get to her, karibuni sana to this week's show. If you're new here, this is X Living Talk Show, where we bring in different guests and also the medical part where we get to demystify all the myths that are around. And thank you so much for being here. Please subscribe if you're new. If you're back to watch us again, thank you so much. I'm your host, Shiko. Karibu sana.
Thank you, Shiko, for having me today. I'm very grateful. And welcome all our viewers for more information concerning physiotherapy. Thank you.
So, Dr. will just go right to it. What is physiotherapy?
Physiotherapy is a health profession that majorly focuses on treatment of injuries, treatment of diseases, treatment of deformity through physical method rather than medication and surgeries.
Okay, now that you know what physiotherapy is, you know, we're talking to now someone who really hasn't heard of this, or if they've heard of it, you know, there's a lot of myths that go around. Because especially with our older parents, when they hear of physiotherapy, wanafikiria ni kuchomwa. Tunasema nitachomwa na nikichomwa I will get worse. Then what? Kama unaweza dig deeper to it, you know, to crush that myth.
Concerning physiotherapy, actually physiotherapy, our main focus is on, we measure on mostly movement, to restore movement and also to improve movement. So by doing that, we normally use different types of modalities for treatment, because we normally treat variety of conditions. If majorly on outpatient, the major condition that we normally treat low back pain, any pain in the neck, any pain in the joint, and also strain injuries. We have muscle sprain, we have ligament strains, and also on fractures, we do fracture management, stroke rehabilitation. So the modalities that we normally use to help us for treatment of those conditions, we normally use exercise therapy. The reason as to why we use exercise therapy is one, exercises help us to maintain the range of motion and also to improve the flexibility in a joint. We also use the manual therapy. Manual therapy is now the use of hand, the so-called massage. We also use the modalities. The modalities that we normally use, one is the heat therapy. Heat therapy. We also use TENS machine. We also use hydrotherapy, and we also use vibrator massager. Apart from that, we also have assistive devices that we can give a patient to help manage the pain. So the assistive devices that we normally have, one, we have the I'll take example of silicone insole. The silicone insole that we have, this one we give to patients that normally have a condition called calcaneal spur. Calcaneal spur is a condition where a patient will come to you in the department and tell you that she has got pain while walking at the calcaneus. Hapa kwa insole. The pain is too much, especially while the patient is walking. So we normally give them this one. This one the patient will put inside the shoe. This one always provide a comfort. Hapo akivaa kwa viatu. So this one is called insole.
Sasa hapa nitaulizia ma baby girls wale wa heels. Pia hapo inaweza saidia?
Actually, someone with calcaneal spur, we don't even advise her to wear heels. We advise her to put on
girls.
flat shoes. And then we also have this one we call lumbar corset. Lumbar corset, these are one of the devices that we normally give to patients with the complaint of low back pain. The pain has been much, especially while they are standing. They complain of much pain while standing and also while sitting. So this is a lumbar corset. Patient will just wrap it at the back and it provide a comfort at the back. So this one we know it's called lumbar corset.
It has some metal like things,
so this one it just provide comfort and also it helps to stabilize the back, and by doing that it reduces the pain. So these are one of the assistive devices that we also issue to patients concerning different types of conditions that they are presented with. Apart
now
from,
for example like this one, is it mostly for patients who had maybe accidents, or what kind of patient is now going to get a recommendation of a lumbar corset?
Lumbar corset is actually for patient with low back pain, but the pain majorly when the pain actually the patient which we normally recommend for lumbar corset are the patient that they complain of low back pain while seated, or low back pain is always severe while standing. So patient of such complaints, they are the ones that we prescribe this one for them. And also we have varicose veins. These stockings we normally give for patients with varicose veins. So patient with varicose veins, we normally advise for these medical stockings. So apart from even the management for the treatment, we also advise patient to have these medical stockings, especially for any swelling. The physician can advise the patient to come for stockings. We normally issue them at Grace Park. And then also we have arm slings. Arm sling, this one we normally issue when maybe you have a fracture and fracture maybe of the upper limbs. We'll after POP application, we'll now give you the
maybe you've broken your arm or something like that. And then if I could take you back a little bit, I understand that so many people are affected by varicose veins. What are they? If we could just divert just a little bit, What are varicose veins?
So varicose vein actually is the abnormal swelling of the veins that majorly it occurs mostly in women as compared to men. Reason being that in women, the women will always tend to have more of biological issues, especially the hormonal imbalances. It can lead to the cause of the varicose veins. So most patients that normally come for physiotherapy department for these stockings more are women as compared to men.
So you hear women, especially ladies out here, say that family planning methods causes the varicose veins. Is that true?
Actually, that one has not been much approved. So that one, the studies I've never heard of such, but family planning is another cause of hormonal imbalance. So it can also contribute to it.
Oh, now it varies from.
It varies.
So this should help with that.
That one actually medical stockings it helps in the management of the varicose vein. Apart from medication, medical stocking also helps a lot in the management of the varicose veins. And it's always it's also affordable. So if you come to Grace Park, you'll find it at affordable price.
Okay. And then there are, I believe now in your profession, there are those conditions that you mostly see. What are those, some of the conditions that you mostly get to encounter, especially here?
Oh, as I said, what physiotherapy is and our main focus, because physiotherapy mostly we focus on the movement, most kabisa movement, how to improve movement, and also how to mostly is to improve the person's movement. And also we focus on we assess the patient, we diagnose the patient, and also we treat the patient. So most conditions that we normally treat, we in outpatient, to be specific, we have low back pains, the most common condition that we treat in the outpatient department. Osteoarthritis, especially of the hip, of the knee, and also of the ankle. We also have sprain and strain injuries, especially for sports. We normally they normally come for physiotherapy, and we also have the fracture management. Physiotherapy, we also do stroke rehabilitation. Some come in the outpatient department, and also we do post-operative management in the outpatient department. And being that Grace Park, we also have inpatient physiotherapy. In inpatient, most common condition that we normally handle in inpatient, especially the post-operative patients, after surgeries, someone's after surgery, the patient physiotherapy is normally prescribed for the patient, being that maybe after surgery the movement of the patient is altered, and also we have the like illnesses like stroke. Patient came for treatment, has been admitted, patient has stroke, physiotherapy do the management, and also in ICU, being that now in Grace Park we also have ICU, and ICU patient mostly they are bedridden, so physiotherapy also come in handy in ICU for the bedridden patient, being that physiotherapy is there to restore movement and also to improve movement. We also come in handy for the bedridden patient, mostly in ICU and also in the inpatient.
That's very nice of you guys. You see now we get to learn all these things and break all the myths that we hear around here, because I can tell you for free, there are so many people who get to be recommended to do the physiotherapy, but they just run away. Do you encounter such patients that come with that mindset of, hey, I mean, utanichoma na hiyo? You get to encounter such patients?
Actually, physiotherapy, maybe you've come with pain, especially pain, maybe any pain, especially any place of your body, and we are doing physiotherapy. Being that now our one of our most common type of treatment is exercises. Imagine the joint has pain, and that same joint you also have to stretch it, of which stretching helps to relieve pain, but pain will be more. But after the session, you will get relieved. So patient, maybe during the session, they feel a lot of pain, not knowing that maybe after session, it will get better. So patient, normally during the session, the pain is too much. Next time when you book them for another session, Amanda. But mostly what we encourage.
You know why I'm laughing? I am that patient. I am that patient who runs away.
So actually, what we normally encourage our patient is to be patient.
Yes.
And also for physiotherapy to work, you have also to adhere with the number of sessions that physiotherapist has booked. Maybe you have got a severe low back pain, and I've booked you for like 3 sessions in a week. You've only come for 1 session and disappeared. The pain won't. The pain won't.
We really have to explain this.
The pain
it's not an inside.
Away.
It's sort of an inside joke between the two of us. I've also suffered from low back pain, especially after having the twins. And now I was asked to come for physiotherapy. I've been one of the most difficult patients she's had last year, because she would book me for sessions and I would just show up for one and not show up again. Then I would come back with so much pain than what I'd come with before. But I'm a true testament that physiotherapy works. If I can stand here and in heels, trust me, it works. So Daktari, we have to take a short commercial break. Then when we get back, today we are doing things differently. When we get back, Daktari will be literally showing us what she does, some of the exercises, what she will do to you when you come with that low back pain, because I feel it's one of the most common pain that people are really going through. Let's take that break.
Healing hands are strong in the heart of Middletown. Grace Park lights the way, bringing hope to every frown.
Hello, my name is Maureen. At Grace Park, we believe in transparency and communication. As a patient, you have the right to receive respectful and compassionate care, to be informed about your diagnosis and treatment options, and to have your privacy and personal health information protected. We understand that your experience matters. We guide our patients through every step of their healthcare journey, including coordinating appointments, providing emotional support, and ensuring you understand the treatment options. At Grace Park, we go over and beyond to prioritize these rights, to ensure our patients feel safe and valued.
Grace Park's legacy, guiding every flight. Grace Park Hospital echoes through the hall. Grace Park Hospital, answering.
Hello, I'm Jelinda. At Grace Park, patient trust is the cornerstone of our practice. We are dedicated not only meeting their expectations, but also exceeding the standards of the care and privacy. We go over and behold to create safe and supportive environments where patients can focus with their wellness journey.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 800 or through our social media platforms. Two peaks living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air. Friends and guests join you.
Welcome back, and thank you so much for staying tuned. Thank you so much to our sponsors of the show, Grace Park Medical Center, where it's where we are, and now we are ready to get in and really show you what they do when it comes to physiotherapy and try to manage that back pain. So, tuoneshe daktari, what do you do? Now I've come in with a low back pain. What do we do?
Thank you, Shiko. Thank you, our viewers again. Low back pain, as I've said earlier, low back pain is a strain injury, especially at the lower back. The lower back is here. Let's use Desmond as our prop human being today. So low back pain, when I talk of low back pain, I mean pain that is always localized here. This is where low back pain is. And low back pain can be caused by many things. One, low back pain can be as a result of sprain or strain injury. Especially those who sit for a longer time and also those who stand for a longer time. They can have muscle strain at the lower back. And when the muscle is strained, there will be pain at the lower back. Another one is maybe you are lifting a heavy object from the ground. So you can lift it, but you awkwardly lift the item from the ground. The back can be sprained. They can be strained and it can also lead to low back pain. And also we have got now some conditions like now the arthritis. We also have the arthritis of the spine, especially of the lower back. We normally call it lumbar spondylosis. Lumbar spondylosis, when someone has lumbar spondylosis, automatically he or she will complain of the lower back pain. So low back pain, those are most factors that can lead to low back pain. So low back pain also varies because one, someone can come with the acute low back pain. Acute low back pain is our pain that has been there for a shorter time. And also chronic low back pain. Chronic low back pain is a pain that has been there for a longer duration. So the management are always different and the approach are always different. For acute low back pain, the patient will respond faster with physiotherapy management than someone with the chronic low back pain. So what we normally encourage patients is, in case you've experienced pain at the back, come, we do our assessment. After assessment, we do an investigation. Our investigation that we normally do is to take an X-ray or an MRI to check the back. So from there, it is now easier to prescribe proper treatment for that patient. So for patients with the chronic low back pain, you'll find now the management takes time. It takes time. But for acute, management is always faster. They normally respond faster. With the treatment. So one of the modalities that we use for physiotherapy, one, for treatment of the low back pain, this one is TENS machine. TENS machine is transcutaneous electrical nervous stimulator. We normally put it at the lower back. This one helps to alleviate pain at the lower back. So when you come for physiotherapy department, we'll use TENS to manage the pain. TENS machine, you can set it for like a maximum of even 20 minutes, for a minimum of 15 minutes, just there. So it always may have many, you can add the frequencies, the modulation. So it depends with the type of the frequency that you need to use for the patient. You can use them how it looks. So this one is TENS, one of the modalities that we used. And this one is infrared. Infrared is one of the heating modalities that we use. We have infrared and also hot pack. Hot pack is now heavier. I couldn't have carried it up to here, but we have it in the department. So infrared, hot pack, these are heating modalities. We also use it for management of low back pain. Apart from that, we also have the vibrator massager. Vibrator massager is this one. We can do the manual massage and also we can use the vibrator massager. So these are the modalities that we normally use for management of low back pain, especially in the department. And the most now common one is now the exercises part of it. Yeah, because now we have to stretch the back, and also we have now to stretch the spine. So I'll demonstrate with our patient. Yeah. Desmond, tako inue hiju. These are some of the stretches that we normally do. When we stretch the back, especially after we've used the heat therapy, we've used the electrogens, we've done now the manual massage, we now stretch the back. Now the back to get relaxed. So Desmond, you'll stretch this one, stretch it a bit. Yeah. Stretch this one again. So these are some of the stretches that you can ask the patient to do even while at home. And we can also do with the patient in the department, and also prescribe some of the stretches the patient to go and do them in the house. Yeah.
I bet it looks easy when you see Desmond doing it. It looks easier. But now you can imagine you have the low back pain, severe low back pain, and you have to do this. But trust me, after all this, after the session, there's usually some relief. You cannot imagine the pain that is coupled with the exercise, but after you're done, you're just relieved.
So these are some of the slight stretches that we normally do in the physiotherapy department. Desmond, kidogo. Lala ukiangalia juu. Kunja hii.
I know another question that one would be curious to ask. Hizi exercises nita lose tumbo daktari?
Hizi ndio maana nawaambia hizi ni za low back. Sio za kulose tumbo. Za kulose tumbo pia tuko nazo. Tuta prescribe, but for now hizi ni za low back.
But tunaziona as if they are similar to what they show us, you know, the gurus show us.
Hapana, hizi ni tofauti, ni za kulose tumbo. Hizi tu ni za low back pain. Actually this one, hizi zinasaidia sana sasa ku stretch hiyo mgongo kabisa.
And then someone will ask, because you also mentioned about massage. So can one just come in for just massage? I don't have any pain at all. I just want massage from you.
Actually, massage that we do in physiotherapy department is a therapeutic massage. It's not even a cosmetic massage. So maybe if you need a cosmetic massage, we can only advise to go maybe kwa spa, maybe kwa salons. But when you come for physiotherapy, that one is purely therapeutic massage.
But one can still come in even if I don't have the pain. I can come for the therapeutic massage.
Therapeutic massage is for pain only. It's for pain management. Therapeutic massage is for pain management. This one, you know, therapeutic massage is normally for pain management. Sio yako ya kujifurahisha.
Sio kujifurahisha bana, nimechoka kidogo.
Utaenda spa. So hizi inasaidianga sana. Hizi exercises are for lower back. It helps to at least relax the lower back and also to stretch the muscles of the lower back. By doing that, the pain, at least it helps to alleviate pain. And also for low back pain, we also have the risk factors. Number one is lack of exercise. If you don't exercise, the muscles will be weak and they now will be susceptible to pain, any pain that can come. And also for lower back, too much weight. It causes a lot of pressure at the back. So when there's a lot of pressure there's a lot of pressure in the back, you will experience a lot of pain in the back. Hence
why pregnant ladies experience the pain. Because of course they are carrying heavy.
So weight also matters a lot. And also sedentary lifestyle. If you are that one person who maybe you come to work with maybe your personal car, you also go back home with your personal car. There's no even time you stretch. That one also can
cause the pain.
pain at the back. So what we normally advise, one is the exercises that I'm demonstrating here. These exercises are purely for low back pain. And what I normally advise the patients is, if you need an exercise that can help, maybe not really that you must have a low back pain, but maybe exercises, we can even prescribe for you an exercise that maybe after work you stretch the back to prevent low back pain. You can also come. We also prescribe exercises for someone to prevent low back pain.
Low back pain. And now with the exercise that you've shown, would you now advise, let's say one of our viewers have low back pain, can they just start, or you recommend for them to first come for you to access? Is it possible to injure yourself more with this, especially if you've not accessed the extent of the pain?
That's a good question. Actually, we normally encourage come, see the specialist first, get be assessed, and the specialist now will prescribe the proper maybe exercises that is recommended for you. Because maybe you can watch the exercises in the YouTube, but maybe those exercises are not recommended for you. You can cause more harm than good to yourself. So we normally recommend come see the physiotherapist first. Let the physiotherapy do the assessment, and the physiotherapist will now recommend the best exercise for you.
Dr. Thank you so much
Karibu.
For being so kind to us and being able to show us this. Desmond, asante sana for being willing and being patient for our viewers to learn about physiotherapy. I'm sure you've learned a thing or two, and now the next time you hear someone or even yourself, you're being told to go for physiotherapy, you won't be scared. It's not as bad as they put it out there. Then again, when you don't have knowledge, definitely you're going to be scared. But now I am sure we've wiped off the fear. Asanteni sana for always coming back every single week. We don't take that for granted. Thank you for subscribing, liking, commenting. If you haven't done so, please do so. Tell your friends, tell a friend to tell a friend. That's how we get to grow as a show. Until next week, barikiwe sana. Bye-bye.
2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges.